Good afternoon. My name is Jeremy Speigel. I'm the consulting attorney with the Camden Medical Legal Partnership, which is a partnership between the Camden Coalition of Healthcare Providers and the Rutgers Law School.
And I'm Maddison. I'm also an attorney. And last month I completed a 2-year Equal Justice Works Fellowship at the Camden Medical Legal Partnership, or MLP.
The Camden Coalition is a community-based nonprofit working to improve care for people with complex health and social needs in Camden, New Jersey, and across the country. We develop care management models with the goal of achieving person-centered, equitable care. Today we'll focus on our MLP program and lessons we have learned through our legal work.
The Camden Coalition developed the practice of healthcare hotspotting to identify individuals with complex needs by utilizing our health information exchange, which collects secure medical information from the region. Over time, we narrowed our focus to the small population that we were seeing cycle in and out of emergency departments and hospital inpatient units.
Our Camden care management model utilizes a team of nurses, social workers, and community health workers to help patients meet their goals. Our objective is to empower patients with the skills and support they need to avoid preventable hospital use and improve their well-being. We engage and enroll patients at the hospital bedside, in the community, and telephonically.
Over time, we realized that while reconnecting individuals to the same healthcare systems might help temporarily, that wasn't addressing the structural problems that we were seeing. For example, coordinating care for unhoused people did not help in the long term if they still did not have a home. In response, in 2015, we launched a permanent supportive housing program for people experiencing chronic homelessness.
Similarly, our care teams recognized that participants faced unmet legal needs, exacerbating the health problems. Our 2016 patient survey found that the vast majority of coalition patients had legal concerns, including accessing government benefits and obtaining and retaining housing. Meanwhile, very few patients could find legal support.
So in 2017, we launched a medical legal partnership between the Camden Coalition and Rutgers Law School to integrate attorneys into coalition care teams. Consulting lawyers work with care teams to evaluate the potential patient legal issues, and in many cases, a lawyer joins the care team to meet a patient and determine the scope of MLP engagement.
Our MLP is unique in several respects. We are integrated with care coordination teams, not physicians, so we are providing legal services as part of a whole person, patient-centered approach. Care teams have great insight into patients because they work with individuals in their homes and in the community. This also engenders a greater degree of trust, enabling us to provide better legal support.
We also benefit from the Camden Coalition's access to medical records and use of data. For example, we're better advocates because we have a complete picture of a patient's history and the ability to reference and access medical records. This MLP within a complex care model is a powerful tool for all patients, and especially patients facing mental health challenges.
90% of patients in Camden Coalition core interventions were diagnosed with a psychiatric and/or substance use disorder. 100% of patients in our supportive housing program have a behavioral health diagnosis. Many of our patients have relied heavily on crisis care services.
Based on our experience serving over 200 individuals these past 4 years, we feel strongly that the MLP, or Medical Legal Partnership model, is an underutilized and underfunded asset for decriminalizing mental health and an essential component of complete crisis care response. Legal issues exacerbate mental health issues, and legal supports should be part of that answer.
When we launched our MLP, we quickly identified an area of need not reflected on the patient survey. Many patients, and particularly patients facing mental health issues, had unresolved engagement with the New Jersey municipal court system. That's the low-level criminal court system in the state. This often included open warrants for failing to appear or failing to pay court-imposed penalties.
40 of the individuals we've served have required this type of legal support for lingering matters involving charges like shoplifting, loitering, and yes, even jaywalking. This has brought us into the municipal courts and pushed us to take a hard look at the systemic forces causing so many patients to face such extended entanglements with the justice system.
We see that police engagement, prosecution, fines, and judicial condemnation, these are not the answers for our patients. Court appearances, warrants, and especially incarceration, exacerbate mental health conditions and make future justice involvement more likely.
We need a paradigm shift at the local level, among police, judges, and elected leaders. Less focus on citations and revenue and punishment, more emphasis on identifying mental health concerns and treatment. The MLP model and an enhanced crisis care continuum should play a role in this shift.
One patient story provides a stark illustration. Tom was jailed 5 times the year before our care team met him. Each instance was related to chronic mental health issues and poverty. A store manager would call 911, police would arrest Tom and send him to jail, where he would remain for a few days, breaking any hope of consistent treatment, only to be let out onto the street with nothing. And this cycle would repeat.
With the benefit of our care team and the MLP, Tom moved from crisis to stability, from prosecution toward empowerment. We located stable housing, connected Tom to services, worked on legal matters causing Tom anxiety and frustration, and provided him a patient ID card that helped him to self-advocate to law enforcement and crisis response teams.
Repeat calls to 911 and police involvement with Tom were counterproductive, as is the case for so many other patients that we have all served. A functional 988 system informed by the participants at this summit, fully integrated into an ecosystem of care providers and care navigators, can be a part of the solution.
As we move in that direction, we encourage everyone to broaden your conception of the crisis care continuum to include the medical-legal partnership model. Connecting patients with legal services, especially when integrated with healthcare coordination and other medical and social supports, can increase stability and reduce future justice involvement.
We want to conclude with a look to the future. In January, we will expand our efforts with a legal fellow dedicated to supporting Cooper Hospital's addiction medicine program. We expect this will be another powerful demonstration of how, the impact a medical-legal partnership can have for patients with mental health issues. And we look forward to sharing our data and findings with all of you as we work together towards decriminalizing mental illness. Thank you.
Thank you.